but you can join over the next couple of minutes whilst I'm just introducing everybody. So today we're going to be looking at communications and public insights in terms of COVID-19 and what's working. We've talked a lot about, in previous webinars, about the impacts of COVID on charity funding, and particularly the international development side. We haven't really talked about the way it's impacted on audiences, and we've got some expertise in the room today in terms of the Development and Engagement Lab, which you may know is doing a long-term study of the audience attitudes to aid and development. We've got Molly Anders, who's the Research Insight and Engagement Lead at the lab, together with Jennifer Hudson, who's Professor of Political Behaviour at UCL, and David Hudson, who's Professor of Politics and Development at the University of Birmingham. So really interested to hear what you've got to say. You know, there's lots of talk about when and if is the right time to talk about international development in this context, when it's right to go, rumours of a DEC appeal, and so on. So it'd be great to get your thoughts on what's actually happening out there and up-to-the-minute information. So over to you, Jennifer and David. Plenty of chance to ask questions later on through Molly. So over to you.
Great. Molly, did you want to kick us off?
Yeah, sure. Just to give you all a little bit of background, and thank you also, Mike, and also Lena. I wanted to thank you all again, to Bond for co-hosting us and for sharing your platform with us. We are so lucky to have Bond as a partner, and we hope that those people tuning in today will also consider attending the other many webinars that Bond are hosting every week. You are keeping us all very busy in the lockdown, and for that we're very grateful. So yes, I mean, who are we? We are the Development Engagement Lab, a research organization which aims to measure and better understand what the public think about aid and development, as well as understand why and how the public get involved. We're funded by the Bill and Melinda Gates Foundation, and our mandate is to support the sector's communications, advocacy, and campaigns work with data and evidence. So we do this by conducting mostly quantitative research in 4 countries: Great Britain, France, Germany, and the US. Today we're going to show you the results from surveys we just got back from the field a couple of weeks ago, looking at attitudes toward development cooperation since COVID began. We also tested 100+ COVID-related messages from UK-based organizations. These returned some unusual, very interesting results. We also asked the public how they would like to see the sector respond to COVID in the global context, in terms of prioritizing vaccines, building health systems. We also had a look at how well the public are connecting the dots on where and how COVID sits, you know, among other sort of global issues and priorities. Excuse me. So why are we doing this? It's become very clear over the last 2 months, longer even, that COVID is going to be a challenge on many fronts. The next front is possibly, or even very likely, to be in developing countries, specifically urban centers with poor infrastructure, overcrowding, places with failing health systems, weak social safety nets. And obviously we're here because we believe that you, those working in development communications, advocacy, campaigns, insights, we believe you will be among those shaping the next front lines against this disease when and if it shifts to more vulnerable communities overseas. We've done this testing to make sure that you're doing that with as much evidence and insight as possible, and to make sure that as much as we can, we are united behind evidence. So with that, I'm going to turn it over to some people who are much less dramatic than I am. Jennifer Hudson, as Mike said, is Professor of Political Behaviour at University College London and Director of the Development Engagement Lab. Jennifer has published on a wide range of topics, analyzing elite and mass political behaviour, including public opinion and engagement with development, support for foreign aid, and campaigns and elections. David Hudson is Professor of Politics and Development in the University of Birmingham's International Development Department. He is the Director of Development Leadership Program and the co-director of the Development Engagement Lab. His research focuses on the politics of development, in particular on the role of leadership in reform processes and citizen engagement with global development. Just a reminder, you are able to answer questions in the Q&A box. Please do that as you see fit. Feel free to enter them. We're going to divide this webinar into 4 sections. So between the sections, I'll bookend with a question to Jennifer and David, and then I'll also check to see what questions you all have. Other than that, I think we can probably kick off. Jennifer and David, do you guys want to make a start?
Sure. Thanks, Molly, and thank you everyone who is joining us this afternoon. As Molly said, we're going to take this in 4 sections and then break at the end of each section. So if you have questions, please feel free to put them in the chat and we will pick as many up as we can. I want to start by looking at COVID-19 in a global context. In the DEL work, we have been tracking how the public have responded to the issues that they're concerned about since September. And in this most recent wave of survey data, we asked respondents to tell us what are the issues that you care personally most about. And what you can see here in front of you is we asked this across 10 different issue areas: economic crises, job security and wages, war, conflict, terrorism, and technology, automation, and artificial intelligence. And you'll see that third row there, global diseases and pandemics. 19% of the British public said that this is the issue that they ranked first, that they personally care most about. And that's followed by climate change and economic crises, not too far behind. When we look at this kind of in the aggregate, so where respondents ranked the top issues, global disease and pandemic is third, behind economic crises and climate change. But it is climbing up in terms of what people are very much interested in. Now, we've looked at this over time. And the slide that you see in front of you is the tracking data that we have on these 10 issues. And if I can draw your attention just down to that bottom right-hand corner where it says global diseases and pandemics, you can see that from February of this year to April of this year, global diseases and pandemics have increased 25%. And that's not surprising. We are living this pandemic and people are responding to that. But if we look at a couple of the other important issues that we know have been of concern for the public, up in the top left-hand corner, climate change and the environment. This has been the kind of issue of most concern since we started tracking, but you can see that downward trend, 51, 54, 49, and now 44% in this last wave. And then on the bottom row in the middle, economic crises, that has held steady in the 40s, but it's upticked recently in this April run of data. So no surprise there that people are concerned about the issues we think they would be. I think it's interesting as we track this next, the British public in June, to see what happens to global diseases and pandemics as well as economic concerns. But I also wonder the extent that issues like climate change, these adjacent issues, will begin to diminish as COVID takes over. We've seen lots of evidence from other studies and concerns that COVID might be pushing quite a lot of other agendas off the radar. So the lived experience of COVID is really resonating with the British public, and this is the issue that they care most about. The second bit of data that we have in terms of thinking about COVID in international context is around international cooperation. We ask the question, the coronavirus pandemic shows that international cooperation in addressing global problems is more important than ever. And you can see that nearly 8 in 10 agree with this statement, strongly agree with the statement. And our view of this is not that the public have become globalists overnight, but that this might be a very pragmatic or practical response, that international cooperation is the best way to solve what is a global problem. Another data point we had was trying to ask respondents how safe they would feel in terms of the crisis response. And here we asked respondents, would you feel safer if the UK went it alone in trying to address COVID, or would you feel safer as part of a global and coordinated response? And then you can see, looking at that left-hand side of the visual, just 14% of the UK public say they would like to go it alone. So there's quite a lot of evidence, not just from DEL data, but from other data sources that are showing quite a lot of public support for international cooperation and for coordinated responses to the pandemic. What we see as a challenge then is to take public support for international cooperation in response to COVID and really relay that to development cooperation efforts elsewhere. So this pragmatic response to cooperate to address and solve global problems is something that we need to pick up and bring to our issues in a kind of very practical way, that these are solutions to big problems. And then the last bit of data here, thinking about context, is around interdependence. So how do the public understand the interdependence of various countries and their response? So this was some interesting data. In September of 2019, we asked the question, what happens in developing countries rarely affects people like me living in the UK. And that blue, that dark bit of blue there in September of 2019, 41% of respondents disagreed with that statement. So they disagreed that what happens in developing countries doesn't affect them. They see the world as interconnected. And that was roughly the same in January when we asked that question. When we asked it in this last bit of data, the line that says April 2020 unprompted, that's the same question. What happens in developing countries rarely affects people like me living in the UK. And you see that it's fallen 10 percentage points, the group that disagree with that statement. And that's really curious to us. But what we thought we were going to get, and this is what we tested, is in the April 20 prompt, we added COVID into the statement. So we split these two groups, and the April 20 prompted statement was, what happens in developing countries with respect to COVID-19 rarely affects people like me living in the UK. And so what we're thinking is that potentially the crisis has made people look a little bit inward and stop making that connection to what's happening elsewhere. It's only when they were prompted to think about COVID and that it might affect people like me living in the UK, did we see the proportion who disagree with that statement coming back to what we saw in September and January. So this is something we're going to keep an eye on. We have our next point in June, and we'll certainly share with the group in a blog post where we think that's what we think is happening there. Final bit before we stop for maybe some questions is we wanted to get a sense of vulnerability and how the public saw the vulnerability of countries in response to COVID. So the question here was, the COVID-19 pandemic shows how vulnerable, and then we inserted either rich countries, poor countries, or all countries are to global problems. So each group, each treatment was seen by a different group. And as you can see there, 89% of respondents agreed or strongly agreed that all countries are vulnerable to global problems. Now, they also say that for rich countries. Clear majorities are saying this for rich countries and poor countries. But what we're taking away from this is the public are receptive to reinforcing the message of collective vulnerability, that we're all in this together, and that cooperation to address global problems should be shared across all countries. Making differences between rich and poor right now is less effective with the public. So I'll stop there, and Molly, maybe there are some questions in the Q&A that we want to pick up one really quickly.
Thanks, Jennifer. Yeah, we just have one question. So from Miranda, are there any tips or best practice for framing issues like gender-based violence within COVID, where the organization is adapting to the new situation but isn't providing emergency response?
It's a really good question. David might pick a little bit of that. We have a little bit of information around gender in some of the message testing that we did. And we also have some more data on gender from this survey. We won't present this afternoon, but we can share with you all on our website later on, so we can pick that up for sure. So maybe we'll just move straight into this next section now.
Actually, sorry to stop you, Jennifer. We have one more question. So from Charlie Enzer, COVID seems like a good entry point to start conversations about wider related development issues. How do we start these conversations about health systems, for example?
Yeah, that's a great question, Charlie. I think the big question on the agenda for organizations is how maybe do we link COVID to our issues and potentially adjacent issues? And is there a set of words or languages or message that resonate that allow us to make that kind of seamless transition? David's going to pick some of that up in the next section. I think right now, what we've seen from this data is cooperation, shared vulnerability, shared efforts, and equal efforts around COVID are messages that are really working. And so if we can use that shared responsibility as we approach other issues around development cooperation, that's an insight that we can take away from this COVID work.
Great. Okay, thank you. Yeah, we can pick up on some of those issues now. So this next section looks at a series of statements or messages and the language they use and how much they resonate with the sample, the nationally representative sample that we showed them to. So we had 131 statements and messages shared with us by the project partners, which are various NGOs that you will know, household names, and also some the way that COVID, the pandemic, was being talked about within newspapers and media discussions, to see what kind of statements that people found that they would agree with more. So the way that we set this up is that the respondents in the survey were shown a pair of two statements that were randomly selected from that 131, and they were asked which one they agreed with more. So it was a forced choice. They couldn't opt out, but they had to go with one, even if neither was exactly right. So to give you a sense of some of the types of messages we asked our respondents, there's a couple of there was a newspaper piece from George Monbiot, that sentence taken from it. There was a tweet by Nigel Farage, and then there was a whole battery of different messages that different NGOs wanted to see how much they resonated compared with other messages. We will be releasing all of this information, the whole list of 131, how they scored on this league table. You can see here the top statement that received the most agreement, 79% of the time, was "I want our government to work with other governments to ensure scientists have the funding they need to find treatments and vaccines that can help end this crisis," and various others there. So we will be putting this into a report, and it will be on our website very shortly. And then at the bottom of the league table, we have a statement there about national responses to the crisis. Shows how the EU goes against nature's grain. People weren't particularly moved by that for a good number of reasons, I would imagine. But there's other things there, so like charity begins at home. We shouldn't be helping people around the world to deal with the coronavirus. That was rejected by the majority of respondents. So here are the top performing messages, and I think there's a number of themes, and we'll expand on this in a moment, but around collaborating, around science, around a vaccine, investments in public health, so going to the previous question around health systems, a global response to a global problem, we're all in this together, and also this sense that it's actually in everybody's interest. There's a very self-interested argument in addressing this to stop the pandemic circling around the world. And there's some of the bottom performing messages. The Blitz spirit, people didn't find that particularly persuasive, and there's an important one that I'll pick up on there. I don't care about women's rights when the UK has coronavirus. Only 22%, or that was only selected 22% of the time compared with the other messages that were shown against it. Okay, one caveat. So a bottom performing message may not be a bad thing. So as we've already seen, there's a couple there but actually rejecting the message shows a supportive position. And here's one of them, that we should stop all aid to other countries while we deal with coronavirus. 23% of the time that was selected, so 77% of the time people chose the alternative message to that. And the similar one there about women's rights. And Nigel Farage's tweet only got selected 39% of the time, so below that 50% cut off between a good or better performing and worse performing message. So how do we make sense of all this? So which frames, issues and language tends to be associated with being selected? We did various things with the data, including trying to do some topic modeling on it, but that didn't reveal very much. So we manually coded all the statements with some key frames that we felt appeared regularly throughout the different statements. So what this is showing in front of you is down the left-hand side there on the y-axis is the different frames that we looked for. So does it mention NGO or charity action? Does it mention vulnerable people? Is it primarily referring to the UK, or is it talking about other countries, or both? Does it mention women and gender? And does it reference developing or poor countries, etc., etc.? And then the messages are all ranked from the left to the right, from the most successful to the least successful. And where the cell is filled in, that shows that that message contained or used that frame. So one thing, immediately just eyeballing this, you can see that where there is more blue cells clustered to the left, that tends to be showing that that frame is associated with successful messages, and then to the right, less successful ones. So if we look at this systematically by putting all the frames into a model at the same time and regressing against message success, a number of frames pop up as really important. Again, another kind of health warning around this. There are only 2 messages that explicitly talk about development aid or ODA, and there are only 2 messages that reference women and gender issues, which is possibly, both of those, a huge surprise, but maybe showing the extent to which NGOs and charities are already starting to think that we have to talk about this slightly differently. I don't know. So we would urge caution about over-interpreting those 2 frames. But the others we had decent sample size on. And we can see here that all the frames that talk about vaccines and medicine were the most powerful, the most successful, the most chosen or agreed with, and they are furthest to the right-hand side. Those that are to the left are the ones that are associated with the worst performing messages. So those that talk about children, talk about other countries, explicitly reference developing countries in all 3 of those frames are negatively correlated with being chosen. All the ones in the middle, they cross that center line, the confidence intervals there, which suggests that there's no significant relationship between them and the likelihood of a message being chosen. But mentioning vulnerability, mentioning international cooperation and partnership, and talking about the risks or the interdependence or the relationship between various parts of the world are all things that made people more likely to choose a message. So we can use this, I think, to go back to the messages and see what it is about those that were successful. The other thing that we did is we mined the statements to look for the specific words that were more likely to be chosen. So not the message as a whole, but are the key words there. And on the left-hand side, they're the more successful words, and those on the right are the words that are associated with less successful messages. And I think a quick look at that suggests that, again, it's reinforcing the sense of talking about science and vaccine, but also using the language of investment, rebuilding, accomplishment, and collective. They are all associated with successful messages. Whereas on the other hand, the less successful messages tended to use words like burden, challenge, risks, etc. So you can see there, and they're just the top 20 that we've shown there. And again, we'll be putting this in the full report when we release it and put it up onto our website to help I mean, we're not suggesting for 1 minute this is, you can create a statement by numbers by using these words, but that by looking at the messages that use these words and the context they're in might give us some, or might give you some insights into how to construct that language. So our interpretation is that the familiar frames of developing countries and children are not particularly welcome at this time. And people may have some hypotheses about children, actually, given the way that the virus seems to affect them differently and the way that that's been reported. Statements that convey a unifying global approach, whether that's through partnership or thinking about how we're all affected, even though we know that there is people are affected differently according to ethnicity, race, poverty, class, etc. They tend to resonate more, as do messages that emphasize science, vaccines, but also highlighting vulnerability. And the word vulnerable is one that seems to be picked up by respondents. So I will stop there, just see whether there's any questions that are worth taking, Molly.
Yes, we have quite a few questions now. So from Karen Sarkiville, in terms of reinforcing collective vulnerability, how do you approach seeking support for communities that are being disproportionately affected by COVID? And I think that infographic that showed children and specific groups didn't perform well, but I think you said vulnerable people were sort of in the middle, right? What is that? I mean, how do we negotiate that?
Mm-hmm. So I think they, I don't think necessarily we should connect the collective vulnerability. I think they're two separate things. They're two separate concepts or frames or issues that we should talk about collective responses, but actually we can talk and should talk about vulnerability. That when the differential impacts of the virus, the pandemic, on vulnerable groups highlighted, that tends to do better. And we've got a little bit more data that we'll share now that also reinforce that people are actually quite aware that we might all be in this together, but it doesn't affect everybody equally. So I think that people are on board for those kind of that kind of messaging.
We have another question from Chris Mitchell. Similar to one of the previous questions, is there any message that has the most sticking power? Not necessarily the one that people agree with, but which has the best ability to change people's views, to really resonate and stay with people?
That we do not know. It's a great question, but yeah, we haven't got any data on that, and that would be something that we would have to look at in a different forum or format. But yeah, interesting point.
Great, and one more question from Miranda Dobson, who would be interested to know how the sampling was done, a sampling question, especially with regards to political preferences. Can you talk through that? I know we do that in the methodology a bit, but maybe a few words on that.
Yeah, so there's a couple of slides at the end that just talk about the methodology. It's a nationally representative sample, both in terms of socio-demographics and also political views and voting, both in terms of the last general election last year and also the EU referendum. The sample is about 1,700 roughly, and the survey house that does it is YouGov.
Excellent. Okay, in that case, I think we're ready to move on. And just quickly, I want to remind everyone that if you're on Twitter and following along, please do feel free to tag us at DevEngageLab. And you can also ask any questions there because I'm monitoring it as well.
Brilliant. Thanks, Molly. Cool. Okay, I'll do the next section before handing over to Jennifer again. So we had a number of questions in the survey that asked people about their perceptions of how COVID will affect developing countries, or was already affecting developing countries. And so here's three items. The first one, with the full question is there on the left-hand side, saying that effectively poverty accentuates or amplifies and makes diseases like COVID worse, and that we should prioritize the needs of the poorest and most vulnerable. And as we can see there, the majority of respondents agreed with that. Very, very few people disagreed, only 9%. And after a decade or so of surveying populations about development issues, I think we can safely say that these are numbers that we're not used to seeing at all. So there is a really strong understanding that we should if we can, prioritise the needs of the poorest and most vulnerable. The second item there is one that is trying to tap people's sense that there's a jeopardy going on here, that actually the pandemic has the potential to reverse a lot of the gains that have been made over the past decade and more even. This still receives a plurality of agreement, not majority, but more people agree than disagree. And again, pretty healthy. But actually, you can see, compared to the other two questions, a smaller number of people agree with this. There's also a large number of don't knows as well, 17%. I think this also sits with some of the previous data and insights that we've got, that progress is something that people actually find very hard to either identify with or consider when it comes to the developing world. People really struggle with this, and organisations like Gapminder, etc., I think have also shown this. So I don't think we even need to go there. It shows that people already understand that poverty makes the disease worse, but also that yeah, progress is a very hard concept for the public in general. And finally, the question here is about whatever the challenges faced in the UK and by extrapolation other richer countries, they will be far worse in the developing world. And again, we see a very large majority agreeing with this, of 76% there. So 3/4 of people agree with this. So again, rather suggesting that the public is already there. They understand that this is going to hit, and it's going to hit hard. And if countries become overwhelmed, and that's, so it's not an argument that needs to be won, that's already been won. I think there's other things that need to be done subsequent to that. The other thing that we asked people is looking across at the range of different kinds of interventions, development cooperation possibilities, things that donors could and should be doing, and international organisations. Which ones did people tend to support? And we gave people a list of 11 different types, from very straightforward, supporting vaccine development and access to vaccines and antivirals, through to medical equipment, providing social protection for households that have lost their income, protecting the most vulnerable through shielding them, green zones has been proposed, but also other things such as trade, policy cooperation, humanitarian support, budget support, etc. And people are asked to rank their top 3 out of these 11. And here's what we see. Overwhelmingly, vaccines received the most support. And then it was medical equipment, water and sanitation, health systems. So good, strong support for health systems there, but actually very much a health first response. Okay, vaccines is a long-term thing, but the others were much more immediate short-term things. Apart from debt relief, which actually that's a very good showing for debt relief, when we've asked a question not around COVID in the past about how important debt relief is for developing countries and issues around development, it doesn't tend to score very highly. It's dropped right off the radar from several years ago. So those more kind of socioeconomic ones, thinking about the downstream consequences of the pandemic, the argument still has to be won on those. People are very open to immediate, simple health responses, but kind of the broader suite of responses hasn't really cut through yet. So the final thing I wanted to share was one of the things that we've been discussing is whether the idea of having a kind of a DEC appeal, a Disasters Emergency Committee appeal, a humanitarian appeal for an international one for developing countries to assist, that might not sit as well with the public as it normally would, given what's happening in the UK, and that it would jar with people, and they would struggle to prioritise their money and essentially their attention overseas when it feels like things are just as bad, if not worse, here. So what we did is we split the sample and 50% of the respondents got asked whether they would be likely to donate to a domestic-focused National Emergency Trust appeal, and the other half of the sample got asked whether they would be likely to donate to an internationally focused humanitarian disasters emergency committee appeal. And we were surprised, I think it's fair to say, that actually it was much, much closer, that just around a third of respondents said they were more likely than not to donate to a domestic-focused one, but 29% of respondents said that they would be more likely than not to donate to an internationally focused humanitarian appeal. So it's not been crowded out, the idea of donating or thinking about supporting those overseas who are in need of support. So that's also shown there, just the average response. That shows a significant difference, but it is a very small one, just half a point on the 0 to 10 scale. And so not as large as we were expecting. So there's a receptivity to both the domestic appeal that's already happened, but also an international one if it were to come soon. So clear understanding of the challenges, though it's still an open question whether this translates into support for development. Support for vaccine development, access and health interventions is much stronger than for other socioeconomic downstream interventions. And public support for an international humanitarian crisis appeal is comparable to support for a national appeal. And again, I'll stop there, Molly.
No worries. Thank you, David. So quite a few questions coming in and comments as well. Charlotte Rose said that it was surprising about children in our previous section. Absolutely, that was very surprising. Sean O'Brien said it might be too early to tell, but what's the likely salience over time of COVID to prompt positive sentiment toward aid, development, international cooperation after the initial lockdown period is over? Are there any other examples from other crises like Ebola?
It's probably too early to tell for the long-term ones, but certainly people's appetite and openness to international cooperation seems to be have ticked up. Jennifer will speak to the question about support for development aid in a moment.
Great, and Nathan Rowe said, do you have any data related to messaging around people with disabilities?
There may be something in the message testing around vulnerable groups. Whether they talk about people living with disabilities, I cannot remember off the top of my head. That was an omission.
Great, so we can look into that one. Deborah Ati, have you had any sense of an increased religiosity? That's interesting as well.
Yeah, no, absolutely, don't know. We toyed with putting a religious message into the message testing, but it didn't make the final cut. So don't know, though I'm sure there will be other data sources tracking people's attitudes at a domestic level that might actually give the direct answer to that. But yeah, that's a really good question.
Yeah, I'd certainly be keen to see over time, I suppose, how religiosity changes over the course of the crisis. Miriam Mohsen from Bond, hi Miriam, asked, were there any questions that were associated with asking for funding? We did look at some of those, didn't we? E.g., more funding is needed to help us get on the front foot of COVID in the global south.
Yeah, they're in there. And again, that's the kind of thing I think we'll pick up in the report that we will share.
Excellent. I think from there I can push some of these to the next section as a bit more relevant as well. So.
Great, thank you. Okay.
Thanks, Molly. In this final section, we just want to share some data around public perceptions of the UK role in fighting the virus and public support for aid, and particularly focusing around the use of aid to support investment in health systems. So this first grouping here is really looking at the UK role in tackling the pandemic. And I'll just kind of start and read through the different messages that were given, the statements that were given, and what you can see essentially from this particular visual is there's a lot of support for the UK taking a very active role in fighting coronavirus. So the first one there is spending UK aid to prevent the spread of coronavirus abroad will help tackle the virus at home as well. And a majority, 50%, agree with that statement. So the idea that we use aid to address issues abroad will help us at home resonates, but not as strongly as some of the other messages in terms of aid specifically. So looking at that next one, this is really interesting, I thought. The specific wording here is the UK should lead the world in developing vaccinations, treatments, and testing to help tackle coronavirus. And that gets significant support. So this idea that the UK is a leader, there's been lots of, I think, very good positive press around DFID's role and the use of ODA to help support kind of vaccine efforts globally. That's received a lot of positive press, and I think that's something that the public are very much supportive of. But the research here, and something that's resonated with research that we see elsewhere, is this third option. And the question here was, or the statement was, the UK should work with others and do our bit as part of a global movement to develop vaccinations, treatments, and testing to tackle the coronavirus. And there are two really important bits here. The one is that the UK should work with others and do our bit. And you can see that in terms of support is really, really positive and agreeable to the public. We've seen in this data, but elsewhere, that to the extent that the UK is not taking on more than its fair share, but it's a part of a global response and it's doing its bit to address the problem, is really an incredibly happy place for the British public. They want to be seen as doing their fair share. I think there's a bit of a kind of fairness underplaying this. But where we see that getting pushed back is when the UK is doing more than their fair share. The notion of working together and doing our fair share is very much where the public sit. And then finally, big international organizations are important for tackling the coronavirus. Again, significant support amongst the British public for that. Now, this will be really important as the pandemic unfolds. There's lots of questions around the role of trust in large international organizations and how they will emerge from the crisis. But there is certainly a starting point with the British public that these are part of the response. And I think that one of the things here to point out is, as David said in the previous section, the amount of disagreement that we're seeing with these statements is really, really small compared to other work that we've done around development and ODA previous. So quite a lot of support, and these messages will work. So just maybe kind of taking away the point, I think the public see a major role for the UK, but its support is greatest when the UK is seen to be doing its fair share. We then wanted to get a sense of support for UK aid. And here we looked at different frames. We've often done a lot of work around understanding whether the public have a stronger sense around moral motivations for giving aid, or more self-interested or national interest motivations for giving aid. But here we looked at three particular frames. The first one is about risk or insurance. And the statement here was that the coronavirus will return to the UK unless urgent action is taken to strengthen health systems in poor countries. And as you can see, a majority would agree with that statement, as do the next two. The next statement is a moral motivation. So using UK aid to invest in developing countries' health systems is the right thing to do. Again, same percentage of agreement as the kind of risk or insurance frame. And just, in the same vein there, this notion of a kind of more self-interested or national interested frame, using UK aid to invest in developing countries' health systems is necessary if we want to protect our own economies and populations. These look very similar. And I think an interesting thing to point out here is the frames for making the case of using UK aid to invest in health systems seem to work reasonably well. There's not a lot of difference between the moral and the kind of self-interested or risk frame. And that's quite different from work that we've seen elsewhere, where the public have resoundingly rejected a national or self-interest argument for giving aid full stop, for giving aid kind of generally. Typically, the British public across the political divide has supported this idea that we should give aid because it's the right thing to do and we should help the world's poorest people where we can. But the linking of UK aid for investing in health systems seems to show that frames are working across the board. So more support here for this notion perhaps of mutual interest in using UK aid. We also then, not surprisingly, asked respondents whether they would support an increase to keep aid spending the same or a decrease in aid spending. And you can see the time points that we have on this, starting September, January, and then this most recent wave in April. And what we've seen here is a decline in the public, the percentage of the public who would say they would increase aid spending somewhat or a great deal. So just 11% of the UK public said that they would like to see an increase in aid spending, and that's down from September and January. I think interestingly is what we've seen here in this most recent run is that 30% say they want to decrease aid spending a great deal. And if you look back, that's up 8% from January and 6% from September. So here's a real disjuncture between support for using UK aid to invest in health systems as we have them, the existing aid budget, that works well. But asking the public to spend more on UK aid right now is showing to be a bit tenuous. And so the question here is the economic reality, is the needs that we have here now in the UK going to start to bite public support for ODA spending? So using UK aid to support health systems it very much resonates with the British public, but this has not translated into support for increased spending on UK aid. So we'll have to keep an eye on this to see if this is indicative of some tougher times ahead.
I think also the fact that the number of people who want to decrease it, I think that's, I mean, yeah, whether the increase side is the right side of the equation to look at, but the decrease is increased.
It's a pretty strong.
It's a majority now.
Yeah. That's our data and methodology. Molly, do we have any questions that we want to pick up for a few minutes?
Oh, do we? Yes, we have quite a few questions, which is a great thing. And also, for those of you putting in questions, we do intend to answer these and send them out separately. So rest assured that those questions will get answered. Dan Stewart asked, or said, it's interesting that you say the argument about poverty making COVID worse around the world is broadly won, but messaging about poorer countries seems to go down badly. How do you square those two things?
That's a really good question, tough one. I think my instant reaction is that I think it's when we use this kind of outdated language of here and there, and us being the kind of the beneficent and gracious givers, and others as the recipients who are kind of worthy and grateful. I think the language of developing countries and poorer countries just conjures that up instantly. Whereas if we can talk about poverty and vulnerability generally, and that it is here and it is there, it is, it's in parts of inner cities and rural areas in the UK, but also in other parts of the world where people live on much lower daily incomes. And I think trying to do it like that is the way you can square that circle. Now, that said, that question did reference developing countries, but obviously in the message testing, it's not something that particularly landed well. So I think this is both a push for us more generally to get on board with much more talking about global language in the same way that the SDGs are pointing towards, right? That a much more universalist agenda, which I think many people are already there, either personally or professionally, but it probably takes a while for the language and the sector to catch up with that as well, in the way that we communicate to the public and where the public is at as well. So that might be one good thing to come out of this.
We're seeing quite a few questions asking whether the messages asked about specific developing countries. I know we did see a few with Syria in them. I mean, was there a distinction in how people responded to messages about specific countries?
Yeah, so all the messages were put to us by our partners. We didn't design it in a particular way. It was much more crowdsourced. So you're right, Molly. Syria was the only country,
and Yemen.
Oh,
I
in
think,
Yemen,
yeah.
the only countries that were specifically referenced. I don't think, they didn't perform better or worse than any others.
And they typically were, the messages that we're referencing were specific countries. We're particularly talking about kind of wider challenges, whether it was particularly around refugees, food security, migration, mobility. So it was a bit of a more of a denser message that was talking about a whole host of problems within Syria or Yemen, and how coronavirus would exacerbate or compound those.
Okay, great. There are a few questions asking how we can extrapolate from this data and apply it to other donor countries. I think that's hard since COVID's been treated so variably across donor countries, hasn't it? Any thoughts on that?
Yeah, I think the question underpinning that is, has the success of individual countries then shaped how the public respond to their own domestic conditions? And does that then shape how they look and are open to what's going on elsewhere in the world? And that's really fascinating. We don't have comparable data. In terms of, we don't have other countries at this moment. We are doing this work in the US next week. So it will be really interesting, and we'll certainly publish the data on our website and highlight where we see UK and US differences. I would venture a guess, and this really is a guess, that there is strong sentiment for international cooperation, for coordination, to address this. I would think across kind of similar donor countries. I think that would be true in France. I think that would be true in Germany. I think that's true in the US, perhaps to a lesser extent. But whether there are real differences given how the domestic response has been, we wouldn't know.
But it would be fascinating to see countries like New Zealand and Australia that have had a very different experience of that, and also Australia perhaps, and you've got Asia and the Pacific on its doorstep, and again, very different experiences of the pandemic. So yeah, it would be difficult to extrapolate this, I think.
Yeah, I'm very much looking forward to seeing the US messages come back from the field. That'll be very fascinating. So Felix Zimmerman has asked, any thoughts on how to distinguish between different audience segments, i.e. which messages work better for more conservative audiences or for audiences who are in vulnerable situations themselves?
Yep. So again, this is something that will be in the report. We've looked to see how differently those different messages perform amongst different audience groups, both people who support or don't support development assistance, and those that are younger or older, more economically secure, etc. We have circulated those numbers amongst our partners. I don't have them to hand. I'm afraid I can't answer directly. That varies, but we will include that precisely that information in the report when it goes up on the website. Thanks, Felix.
We have another question from an anonymous participant. Do you think there will be negative sentiment around UK aid spending that is already committed? It's certainly hard to predict.
Again, we don't have data on it, so I don't think so. And I think, and the reason I would say I don't think so is it's to the extent that how that aid is being committed. I mentioned earlier about the relatively positive response to using UK aid specifically to address vaccine support and development. And I think to the extent that if there is something that we can take from this data, if UK aid is being used to support an immediate response to coronavirus and investing in health systems overseas, that's something that's landing relatively well with the UK public. So I can't think that there would be kind of a backlash against a really good and solid application of UK aid to address this problem.
Excellent. We did look at, I have a question from Harriet Roberts, the DEC 29% that would donate, is that similar or more than in a pre-COVID world? I know we looked at support for spending UK aid broadly, but I don't think we've looked at DEC specifically.
No, we haven't. So we don't have any comparable numbers on that. We've looked at people who donate or say they donate more generally, and that's around 1 in 5. And that at the moment it has been higher in the past. And that data and a report on that actually on people's propensity to donate and why they do and why they don't is available on our website, which is you can find at developmentcompass.org. But we don't have anything on DEC appeals, no, sorry.
Excellent. So we have still quite a...
Molly?
Yes.
We do.
Oh.
I'm mortified because I did it. So there is a blog on our website that looked at an appeal a few years ago, which used a very different method. So it might not be comparable at all. But if you're interested in that, yeah, go to the website. There's one on the images that were used in a previous DEC appeal. So yeah, sorry.
Yeah, of course, we have that blog that looks specifically at the campaigns. Yes, so if you go to our website, developmentcompass.org, and you go to the blogs, you'll see it's I think one of the top 3, the DEC appeals comparison. So another still quite a few questions coming in. I think we have like 1 minute left.
Okay.
How to choose among them.
We will follow up as well on any unanswered questions, right?
Yeah, there was one question from Charlie Ensor. If we focus on messages that reinforce weak public health systems, do we actually undermine wider aid messaging, i.e. we've been giving aid to Africa for years, why are they still struggling? Shouldn't we reinforce positive examples when it comes to public health in developing countries by referring to the successes of public health elsewhere, i.e. community-based health surveillance, responses to Ebola in West Africa, and the long-term capacity that is built? I don't recall testing messages that refer directly to previous epidemics or pandemics or diseases in developing countries.
No, but I think that's an excellent idea. I think it'll take more than that to shift kind of the public perceptions of progress and the state of the world, but absolutely positive messaging has really got to be part of it, especially when one considers the difference between how we've responded and how we've experienced the pandemic here in this country compared to almost every country in Africa thus far. But also, it is an opportunity to highlight success where it exists.
Great, thank you all so much. So that's the end of our time. As promised, it was 1 hour on the dot. If you enjoyed this content and you would like to take a closer look at the reports and blogs and briefs that we have coming out, constantly churning out research at the moment, please do look up developmentcompass.org. That's our website. We are the Development Engagement Lab. Thank you again to Bond for co-hosting this event. We could not have done this without you. Follow us on Twitter @DevEngageLab. And yes, please stay tuned for more of this content. Thank you all so much.
I'd just like to say thank you to Jennifer and David and to Molly. Actually, we'd love to have you back if you can keep us updated on the progress of this emerging messaging. It's absolutely fascinating. We've had 150 people joining us today, and thanks to you all for taking part. There are all sorts of Bond webinars coming up. We've got stuff on delivering programs virtually, mental well-being, philanthropic giving, business planning in a crisis, and so on. So just keep abreast of our website. And thank you very much for joining on this Friday afternoon. I hope you have sort of restful weekends and look forward to seeing you again on a Bond webinar. And thanks again to Jennifer, David and Molly for such a fascinating afternoon. Thanks very much, everybody.
Thank you. Thanks very much.
Thank you. Take care.